Aquatic therapy in stroke rehabilitation, systematic review and meta-analysis. The stroke occurs due to a decrease or a blockage in brain's blood supply. It can be ischemic or hemorrhagic, and it results in a cerebral tissue damage. Also, it has physical and psychological consequences. It's the most common cause of disability, and it has an important health and socioeconomic impact. For this review, two independent reviewers searched electronic databases for controlled studies, which tested the effectiveness of water-based therapy in supporting stroke recovery. The first screening was based on title and abstract. Instead, a second evaluation was performed on full-text publications. Disagreements were solved by consensus. The selection criteria were randomized controlled trials, adult stroke subjects, aquatic therapy as intervention, pre- and post-interventional evaluation of primary outcomes, 5 individuals per intervention at least, written in English or in German. The methodological quality and risk of bias of included studies were assessed using the Pedro scale. The following data was extracted: subjects' characteristics, number, age, gender, time since the stroke, stroke etiology, and stroke location. Methodological aspects, so study design and methodological quality, intervention description, number of intervention sessions, duration, type, intensity of intervention, aquatic environment characteristics, and then the outcomes. The included studies were divided into 3 categories: trials comparing aquatic therapy with no intervention, trials comparing aquatic therapy with land-based interventions, trials comparing different aquatic methods. In addition, a subcategorization, depending on which type of aquatic therapy approach was used, divided the methods into established aquatic therapy, aquatic treadmill training, others approaches. 28 articles corresponded with the inclusion criteria, but nevertheless they were very heterogeneous. All the studies have a common aspect. In fact, all of them have done a pre- and post-operative evaluation, but no study has carried out a long-term follow-up, so no prediction can be made about the persistence of the positive effects induced by the therapy over the time. For each made comparison, the review always reports number of stroke patients included, range of time elapsed between the acute phase and rehabilitation, number of rehabilitation sessions, duration and type of each session, water characteristics, in particular temperature and depth, intensity of exercises. Results: aquatic therapy appears more effective than no intervention in gait, balance, emotional status, health-related quality of life. In the same way, aquatic therapy is more effective than land-based intervention in gait, balance, proprioception, emotional status, health-related quality of life, physiological indicators, and cardiorespiratory fitness. Instead, aquatic therapy and land-based intervention show similar results regarding the ADL independency. From the comparison of aquatic techniques, results that established concepts of water-based therapy are the most effective. Instead, aquatic treadmill walking is the least effective. No significant differences in effectiveness are observed regarding the gait parameter. Discussion. Water therapy results in better rehabilitation effects than rehabilitation on land in the following areas: gait, balance, proprioception, muscle strength, quality of life and emotional state, cardiorespiratory fitness, and physiological parameters. About gait and balance, the studies show an inhomogeneity of effect sizes. However, water-based therapy is more effective than no-intervention. About proprioception, water-based walking and balance exercises are more effective than aquatic treadmill walking. About muscle strength, only aquatic treadmill walking and established concepts of water-based therapies induced additional effects on this parameter. About cardiorespiratory fitness, aquatic therapy is better than no intervention. In addition, walking and balance water-based exercises are more effective than treadmill training. About health-related equality of life and emotional status, water therapy appears only moderately better than the land-based therapy. About spasticity, the only trial that tested the potential of water therapy on spasticity just indicates that it's better than no intervention in the stroke rehabilitation. And as we have already said, aquatic therapy and land-based therapy have similar effectiveness on EDL independency. Strengths and limitations of this article. Strength, this manuscript included and analyzed more studies than previous reviews and meta-analysis. It's the first meta-analysis that investigates the potential of water-based therapy on reducing cognitive and emotional decline and spasticity, and it compares the effectiveness of different water-based therapy methods. The limitations are basically the heterogeneity of the studies and that there's no existing data about long-term effects of water-based therapy in this course. Thanks for your attention.